What are common phosphate binders for kidney disease? Have you ever wondered how people with chronic kidney disease manage their phosphate levels? Phosphate binders play a crucial role in this process. These medications help control high phosphate levels, also known as hyperphosphatemia, by reducing the absorption of phosphate from food. This is especially important for individuals with advanced chronic kidney disease or those on dialysis, as their kidneys struggle to excrete phosphate effectively. When phosphate builds up in the body, it can lead to serious issues like vascular calcification and bone disease, which can worsen kidney health. Phosphate binders generally fall into two main categories: calcium-based binders and non-calcium-based binders. Calcium-based phosphate binders, like calcium carbonate and calcium acetate, are the most commonly used. They work by binding dietary phosphate in the gut, which helps to excrete it through stool. These binders are often the first choice because they are effective and cost-efficient. However, it is essential to monitor their use, as excessive calcium intake can lead to vascular calcification and elevated calcium levels in the blood. On the other hand, non-calcium-based phosphate binders include options like sevelamer hydrochloride and sevelamer carbonate. These binders do not contain calcium or aluminum, which means they can reduce phosphate absorption without increasing calcium levels. This can help lower the risk of vascular calcification. Another non-calcium option is lanthanum carbonate, which binds phosphate effectively with minimal absorption into the bloodstream. Sucrophoric oxyhydroxide is another iron-based binder that also helps reduce phosphate absorption. While these binders are effective, they tend to be more expensive and may cause gastrointestinal side effects, such as nausea or constipation. Aluminum-based binders were once common but are now rarely prescribed due to the risk of aluminum accumulation, which can lead to toxicity and damage to bones and the nervous system. Phosphate binders are typically taken with meals to ensure they bind dietary phosphate effectively. The choice of which binder to use depends on various factors, including serum calcium levels, the number of pills a patient can tolerate, cost, and individual health circumstances. Managing phosphate levels is vital for kidney health, as it helps reduce complications that can affect overall health and longevity in patients with chronic kidney disease. While phosphate binders are essential in controlling phosphate levels, researchers are still studying their long-term effects on health outcomes. For those with kidney cancer, phosphate binders are not directly related to cancer treatment but are important for managing kidney function in patients who may have both conditions. Always consult with healthcare professionals for personalized advice regarding the use of phosphate binders, as improper use can lead to complications like high calcium levels or gastrointestinal issues.